first thing I want to talk about is the STOP Act, the Synthetics Trafficking and Overdose Prevention Act, which has to do with fentanyl being shipped through the mail. My understanding is that you all have arrived at sort of an agreement with the House, because initially there was some back and forth about whether the House's version of this bill was strong enough or as strong as the Senate version. Can you tell us a little bit how that played out and how it was resolved?
Sure. Well, first, thanks for doing this. And I didn't have the opportunity to hear all of what Dr. Adams said, but I heard the last part of the conversation, and you're raising awareness just by doing this meeting, and I think that will help with the issue. This sounds powerful, but it's going to help save lives. It will, just by raising awareness and consciousness about what's going on out there. And fentanyl is our #1 killer in Ohio by far. Mm-hmm. And the national data seems to indicate that's true nationally. So wherever you're from, there's probably a different mix of drugs causing the addictions, causing the overdoses and the deaths. But in Ohio, it's fentanyl. Probably 2/3 of our overdose deaths last year were from fentanyl, 2/3. Right. And so just as we've made progress on prescription drug prescribing, we're not there yet, by the way, overprescribing still occurs. Just as we've made progress on heroin, now we have the fentanyl wave coming in. And in my hometown, Cincinnati, Ohio, since 2013, there's been a 1,000% increase in fentanyl deaths. So this is the new poison, the new drug, and it's coming in from China for the most part, based on what the experts tell us, and it's coming in through the United States mail system. And that's outrageous, and we should stand up and stop it. It's a federal agency. So for the last 2 years, we've been doing research on this. We did an investigation in my subcommittee, 18-month investigation, and we learned what you will hear around the country, which is fentanyl is being purchased primarily online. And when you talk to the traffickers and say, I'd like to buy some, you know what they say? We'll guarantee delivery if it goes through the post office. FedEx, DHL, UPS, the private carriers, under federal law, are required to provide information about their packages to law enforcement. It's called advanced electronic data, and if you want to send something by FedEx, you've got to provide that if you're an international sender, and yet the post office doesn't require it. And 16 years ago, after 9/11, when Congress required all the private carriers to give law enforcement this information, they exempted the post office, but said, let's study it, because obviously you want to have the post office be part of this, so let's do a study, and let's make a determination. 16 years later, that has not happened. And therefore, the majority of packages that come into our country, which come in through the United States Post Office, 900 million packages a year, think about that, do not have this data on it, so law enforcement can't find the needle in the haystack. They can't determine which packages might be suspect for having fentanyl. So I've gone to our UPS and FedEx and DHL distribution centers and seen what happens there. Customs and Border Protection is able effectively to pull a package offline. That can't happen through the post office. Now, in the last year, thanks to the pressure, I think, from our subcommittee and others, the post office has started to do it, but still roughly 350 million packages a year are unscreened. So the STOP Act is very simple. It says the post office should have to do what these other carriers have to do, require this data. Law enforcement's for it. We have a broad coalition of support. We've been working on this for a long time. It had to go through my committee, the Finance Committee, and the Ways and Means Committee, because it has international trade implications because of the UPU, which is a postal union agreement with other countries. And we had disagreements along the way, but now we finally come together as of the last couple days, not just with the House, and I think the Ways and Means Committee bill has been strengthened considerably just in the last week, and I commend Chairman Brady, Congressman Bishop in particular, who've worked hard to do that. But also the United States Senate has acted in the sense that at our markup day before yesterday in the Finance Committee agreed to report out this legislation separately from our other opioid legislation because it's not related to Medicaid and Medicare, which is what the other ones were related to, so a separate markup, which I really appreciate, so it'll be on the floor. And my hope is that we'll have a vote on this in the House next week, a vote on it in the Senate before the August recess. Okay. The Senate needs to take up this opioid measure this summer before we go for our week-long mini August recess. So my hope is that this will end up being signed into law by the President, and it will begin to make a difference right away. Mm-hmm. The biggest difference, frankly, I think is going to be reducing the supply, which is going to be helpful given that this poison is our #1 killer now, but also raising the price. Because one reason fentanyl has caught on is because it is so inexpensive.
It's really inexpensive, right? During this process, the whole thing has been very bipartisan just because basically everyone has been affected, whether in their personal lives, their constituents. Have there been any political divides, though, maybe going on behind the scenes that you've been surprised by or things that you've really had to work out?
Well, this is Congress, so there is some partisanship and everything. But I think on this issue, we have maybe uniquely been able to avoid the partisanship by making it nonpartisan. So the Comprehensive Addiction and Recovery Act is co-authored by Sheldon Whitehouse and me. We're a little bit different on our political philosophies on other issues, but on this one, we realized 4 or 5 years ago when we first came together on this that it was affecting our states dramatically, killing people through overdoses, and then as tragic as those overdose deaths are, just the impact on every community in every way. So hospitals, emergency rooms full, our jails full, our employers saying they can't find people who can pass the drug test, and families being torn apart, our foster care system totally overburdened. So we came together, and we're beginning to make progress, in my view. I just spent some time in Ohio over the last few weeks meeting with people who have received grants under the Comprehensive Addiction and Recovery Act and under the Cures Act. And we're beginning to see some new innovative programs being put in place. I've had 3 meetings just in the last 10 days where we've looked at these quick response teams as an example. So yeah, it's been an exception in the sense that it's been far more, I would say, even nonpartisan, because this is a crisis that affects every single state, every congressional district, really every zip code.
One of the things that Democrats have asked for is to bring in drug companies who made some of these prescription painkillers and have them essentially account for their role in this crisis. Do you agree that a hearing would be appropriate for that?
I think that's fine. I'd rather look forward than look back. And our legislation, CARA 2.0, Comprehensive Recovery Act 2.0, which is bipartisan, as an example, has a 3-day prescription limit for acute pain. Which, by the way, is controversial, and the AMA opposes that, as do others. I get that, but let's deal with the crisis that we have. And I heard what Dr. Adams said at the end there about non-addictive pain medication. I couldn't agree with him more, and I agree with him that Commissioner Gottlieb, Scott Gottlieb, is on this. We talk regularly about that. I do think the administration wants to move forward with getting some of these non-addictive pain medications out there so that people can have alternatives. But overprescribing still occurs. It's still a problem, not just with what you might think of as an accident or an injury being used, but with regard to the extraction of a wisdom tooth. It is, to me, totally inappropriate that our children are being given opioids for something like that. There may be some very acute cases, specialized cases where it's necessary, but as a regular prescription for something like a tooth extraction, it is wrong, and we need to stop it. So that's where my focus has been, and I think we need to continue to make progress across the board on this issue, but still, probably 8 out of the 10 people who overdose in my home state of Ohio had their first opioid experience with a prescription drug.
Right, right.
And often it was because of an accident or an injury or a medical prescription. That's outrageous. We should be pushing back on that. And so I'm focused more on looking forward, but I have no issue with having that testimony or the lawsuits that are moving forward. The point is, though, what are we doing right now? We have to put a tourniquet on right now because we have an epidemic, we have a crisis. It's the #1 cause of death in my home state of Ohio. It's probably the #1 cause of death in America for people who are 50 years and younger. And we don't have time to go through all the processes of, looking back, as important as that is. We've got to look forward as well.
Now, I know you said you don't want to look back, but I hope you'll permit me to ask this question. One of the concerns that your Republican colleagues have is about the Medicaid expansion under Obamacare, which your state expanded. And they have said that they're concerned that the expansion caused more people to then have access to the healthcare system and then to be prescribed an opioid, and in some cases perhaps contributed to the epidemic that we currently have. Do you have an opinion on that?
Yeah, I don't think that's the issue. I think the issue is overprescribing, and whether it's Medicaid or private pay, whether it's your health insurance program or mine. I think every health insurer should be focused on it. Every business should be focused on it. Certainly our medical community and our dental community should be focused on it. Medicaid, is like other healthcare insurers. It has been guilty over the years of allowing people to have too many prescriptions. By the way, we also have a prescription drug monitoring act that we're trying to get done. It was part of the original care legislation. It was dropped out in the conference with the House. It did pass the Senate. And that would help a lot, not just with regard to Medicaid, but with regard to Medicare and with regard to private insurance, by saying that when someone gets a prescription in one state, there should be a better monitoring program. Most states have it now, pretty much every state does. But interstate is a real problem. Think of Ohio, where we've got West Virginia and Pennsylvania and Kentucky and Indiana and Michigan, and we need to know what's going on across state lines as well. And this legislation is necessarily is necessary because it's a federal issue, because it's an interstate issue. And that would help quite a bit, including with regard to the issue of Medicaid and overprescribing.
Earlier in the conversation, you mentioned alternatives to pain. And one of the things I discussed with the Surgeon General is the studies that have shown, or suggested rather, that states that have legalized marijuana have lower incidences of opioid overdoses and deaths and addiction. I was wondering whether you have yet taken a position on Senator Cory Gardner's bill, which would allow states to decide for themselves, essentially without federal intervention, whether they should legalize marijuana.
Mm-hmm. Yeah, I mean, I heard what Dr. Adams said, and I don't disagree with him. I've probably met with a couple thousand addicts or recovering addicts just in the last few years, and many of the stories are similar. Every treatment path is different, and every family situation is different, and so on. But typically, people start with marijuana and with drinking. And so the notion that it's not a gateway, I find hard to believe. And so it doesn't mean everybody who smokes marijuana ends up being a heroin addict. That's not true at all. But it is true that we have as a culture, whether it's taking prescription medication or other pills for anxiety or for depression, or whether it's smoking marijuana or drinking, we have a substance abuse problem, and we have an over-medication problem. And that's the broader cultural issue here, and I don't think we can ignore that. So medicinal marijuana is one thing, and I agree with Dr. Adams on that. Ohio has medicinal marijuana now. We're just beginning this process. We've got to be sure it's heavily regulated so that it's not abused. But I don't think we as a country ought to say that we're condoning the use of these substances by taking away the illegal status and making them legal for recreational use. I think that's a mistake, because I started in this business, 20-some years ago, maybe 25 years ago, on the prevention side. I started my own coalition back home, which is still in existence. And I'm the author of the Drug-Free Communities Act, which has helped spawn 2,000 community coalitions around the country focused on prevention. And the prevention message is getting lost in all this, which is that if there's a sense of social approval of something, use goes up. And that's just one of the basic, building blocks of prevention. And social approval or disapproval is in part through the legal system. So criminalization is one issue. I'm, as you know, a big fan of treatment and recovery, and I don't think we can lock people up and somehow think we're going to get out of this issue. We've got to provide treatment. We've got to provide the opportunity for people to deal with this as a disease, which it is. But on the other hand, it does matter in terms of how we as a country and as a society look at this. And I think we need to change that cultural norm. I heard discussion this morning from Dr. Adams saying we've reduced the opioid prescriptions by about 20% over the last several years. Now, that's great. I'm sure you know this, but the United States remains the only country in the world that has this massive prescription issue. In other words, even with a 20% reduction, we by far lead the world. I mean, it's not even close. As to other developed countries, we still have about twice the prescription drug use, for pain medication. So it is, and as to other countries, even more so. So to me, it's a broader issue about substance abuse and about self-medication and about prescribing, and I think the prevention message needs to be very strong. I think the administration recently came out with a few ads, as you know, with regard to use, and they focused on prescription drugs and focused on youth, and that's good, and I support their efforts. We need to do much more, much more. We have $10 million authorized in the Comprehensive Addiction Recovery Act. It's already been authorized. It's out there. It's ready to be used. We should have a national media campaign. We should make sure the prevention message is based on good science, and we're testing it. But I think that is an enormous opportunity right now for us to get this message out. One, the connection between prescription drugs and addiction and overdoses and deaths and so on. But others, just this message of trying to get young people to understand that the overprescribed culture that we have is harmful to them and harmful to their future. And I think marijuana, frankly, is something that ought to be part of that discussion.
And so do you know whether you'll vote in favor of the STATES Act?
I'll probably vote against it from what you just told me about.
You'll vote against it?
I'll probably vote against it, but I haven't had a chance to look at it closely.
Right. It essentially would just let states decide where they stood. The president has said that he would probably support it.
Yeah, good for him.
One thing I was also hoping to touch on, just because it comes up a lot in these discussions about overprescribing and treatment and things like that, the coverage aspect of all of this. One of the kind of main discussions happening on Capitol Hill that we're hearing a lot about with as reporters has to do with this lawsuit that the Department of Justice has on the Obamacare regulations on pre-existing illnesses, essentially saying that repealing the individual mandate fine should therefore invalidate other parts of Obamacare, including those that require insurers to cover pre-existing illnesses at the same cost as any other illness without charging more, without turning people away. Where do you stand on that?
Yeah, I don't know how it relates to the opioid issue. How does that relate?
Well, because they're arguing that the Democrats are arguing that if they were to become invalidated, then people would be unable to access health insurance treatment because of a pre-existing illness.
Yeah, I mean,
because addiction would be considered a pre-existing illness.
The difference is that the Justice Department has now weighed in on an issue that the states are divided on. You have some states like mine that have taken the side of the lawsuit that the Affordable Care Act should be invalidated, partly because they view it as unconstitutional and partly because of the fact that the Congress did pass as part of the budget an elimination of the individual mandate, and therefore the other parts like community rating ought to end. So we'll see. I mean, the courts are going to look at this for a while. This is nothing that's going to happen in a short term, because it'll probably be several months, if not a year, before there's a court decision. But I guess it doesn't surprise me that the Justice Department has weighed in with states like mine that have taken that position. Other states have taken the opposite position. And we need to fix our healthcare system. It's broken. The costs are outrageous. If you look at what's happening in my state, we have double-digit premium increases again. We have higher deductibles coming up. Some of us have been promoting other solutions. The Alexander Murray approach, which deals with the so-called CSRs, would help to get costs down. Susan Collins has an approach to deal with those who should be in high-risk pools, to take them out of the other risk pools to reduce the cost for others. This has been done successfully in states like Maine. We ought to be doing that, in my view, and we were very close, as you know, Kimberly, to passing some of those. Right. And the last minute, Democrats, even some who had been actively involved and the equivalent of a co-sponsor of those bills, pulled away. Right. This just in the last several months. So my view is we do need to fix our healthcare system. The Affordable Care Act has not worked. It's resulted in far higher costs for the people I represent, particularly those in the individual market and small businesses. They can't afford these double-digit increases. It just it makes healthcare out of reach. So we need a broader effort to reform the effort, and that I guess the lawsuit may inspire some of that over time, but I hope Congress will act long before that lawsuit is resolved.
And the reason I bring it up is because, as you say, so much of this has been so bipartisan, but then there are kind of little fires that ignite over different parts of the healthcare system that then emerge. Your state,
even in the healthcare debate which occurred, you recall that some of us pushed for, Senator Capito and me in particular, a separate approach to dealing with the opioid issue, and specifically to have federal funds that were allocated to the treatment and recovery for opioids. And at the end, we got a commitment for, I think it was $47 billion over 10 years just for that issue. Right. And that was based on a rough calculation of how much of the expanded Medicaid was being used for substance abuse treatment and mental health treatment, and then providing that funding so that it could be done more efficiently, more effectively. And so there is, on both sides of the aisle, I think you're right, an interest in this. And I think if we had gotten that $47 billion for treatment, we would have, an enormous improvement in the treatment that's being provided. But in the meantime, Congress also appropriated in the budget bill an unprecedented amount, $3 billion a year for 2 years. And that's the funding going through CURES and CARA and some other funding, and that is beginning to make a difference back home. I've recently seen a number of examples where that funding is being used to do some innovative things, including when somebody overdoses and is given this miracle drug Narcan to reverse the effects of that overdose, then getting them into treatment right away by having a much more aggressive, proactive approach. And much of that is being funded by this new bipartisan effort here in Congress to provide that help.
Right, right. And we're just about out of time, but I wanted to, it sounds as though you're optimistic that the Senate will be able to send something before the president's desk. Is that right? I
am, yeah. Look, the Health Committee has already acted, the Ways and Means Committee has already acted over on the House side. On our side, you spoke to Chairman Walton this morning, I understand. Mm-hmm. So his committee, ENR, has already acted. So there's been a lot of movement. I think the House has already passed maybe 26 bills. Next week they're going to take up more bills.
That's right.
The Judiciary Committee is likely to act in the next week, I'm told. Finance just acted this week. So I think we're moving toward a package. I do think there's some things missing in there, sure. And we're going to work on that on the floor. I mentioned the STOP Act, which is going to be part of the mix. There's also a big issue with regard to how Medicaid reimburses treatment centers. Mm-hmm. There's a 16-bed limit now.
IMD exclusion.
The IMD exclusion.
We discussed that this morning.
Yeah,
yes. Mm-hmm.
And we had a good debate on that in committee. I wasn't able to offer the amendment I wanted to offer because the pay for was considered to be out of the range of what was germane in our committee setting. In other words, it was too expensive.
Right.
But Senator Durbin and I have had a bill on this for some time. We've got a new bill that I think makes a lot of sense, that not only raises the cap so that these good treatment centers have the opportunity to provide help to people, but also would encourage the use of all three Medicaid-assisted treatment options, so methadone, Suboxone, and Vivitrol, which I think is good policy as well, and actually helps in terms of the cost of it.
Right.
I can't tell you how many times I have heard back home someone saying, my son, my daughter, I was ready to get into treatment, and there was no room available. And I've been to great treatment centers in Ohio that rely on Medicaid that have 16 beds that, tell me they're ready to expand.
Right.
And so you have this demand, and you have treatment centers that are doing a great job that can't supply it. It's crazy. And I had one father tell me the story that I'm sure many of you have heard, which is his daughter is ready. She's been through treatment once. It didn't work. He felt like she finally kind of hit rock bottom, understood the need to get into treatment, was ready to go. They go physically to the treatment center, and they say, we got no room. It'll be a few weeks. And in this case, this young woman overdosed and died within 10 days. And if that treatment bed had been available, the result would have been very different. So I think that IMD exclusion is one that we must deal with. We couldn't deal with it in committee, I get that. We've got to deal with it on the floor. We've got some good pay-fors, we think, that would not affect healthcare negatively, but would help with some efficiencies. And we just got to do it. So this morning, I was out waiting to come in, and a gentleman approached me. Perhaps he's been part of your program this morning, and he showed me the photo of his son and told me the story of his son, Garrett, who had died of an overdose, and told me about his struggles as a teenager and how he had gotten into this issue. And I guess I just said to him, this is a story that I hear way too often, and we have a responsibility, all of us, to figure this out as a country. And it's not going to be solved here in Washington, D.C. I think we're much better partners now than we were even a few years ago. By passing CARA and CURES and some other legislation that has helped, we're beginning to engage now. Right. But it's going to be solved in our local communities, each of which has a slightly different problem, and it's going to be solved ultimately in our families and in our hearts. I mean, this is, again, it's a broader cultural issue, And having been at this for a couple decades or so, it was cocaine, and then it was meth, and now and it was prescription drugs, and then it was heroin. Now it's fentanyl, and by the way, crystal meth, which is coming back in a big way in my state. So we take our eye off the ball. We declare victory on one drug, and another one crops up because we're not dealing with this fundamental issue of how to deal with a society that is too addicted to the self-medication, and this is something that, as a country, we've got to face. Yes, we're in the worst crisis of our history right now. We're losing more people than we ever have to any drug. This is an epidemic, but it's part of a broader problem we have as a culture and as a society that we need to address.
Sure. Senator, we can't thank you enough for being
Thanks,
here with us, for sharing.
Thanks,
I know it's going to be busy next couple weeks trying to get all this passed.
Yeah.